Hi, my name is Kelly Murphy. I'm a senior at Shaw University, majoring in exercise science, and today we're going to be doing the foot, ankle, and lower leg evaluation. It's my patient, Alexandra Maznika. So first we're going to start with the squeeze test. I'm going to start about mid-calf, pushing the tibia and fibula together, all the way down to the ankle, checking for pain. You feel anything there? No. Alright, so that test is negative. Next we're going to palpate the location of the dorsalis pedis artery. This is just lateral to the first metatarsal bone. So I'm going to lightly palpate to find the pulse there. There's a pulse there, so that's good. She's getting blood flow into the foot of that part. Next is the posterior tibial artery, which is down around here. And there's the pulse there. Next is the capillary refill test. If my cameraman could just come around here this way. We're going to squeeze the toe until it turns white and wait to see if it returns color, which it does, so that test is good. She's getting good blood flow to the toes. Next is we're going to the active range of motion. So first we'll do plantar flexion. So push your foot as far away from yourself as you can. Good. Dorsiflexion, back up. Inversion inwards and eversion outwards. Is there any pain there? No. Alright, that's good. Next we're going to do passive range of motion. So I'm just going to place my hand above the malleolus, grab the foot by the heel, push up for dorsiflexion, plantar flexion, push it down. Inversion, we're going to grab the foot from the outside, push it in, and eversion, push it out. Alright, then next is the manual muscle test. So for dorsiflexion, we're going to have you push up against my hand, plantar flexion, push down, inversion, push inwards, eversion, push out. Any pain there at all? No. Alright, that's good. So then we're going to do the anterior drawer test. I'm going to grasp her heel, the foot on the anterior aspect of my forearm, put the other arm as close as possible to the joint line, and draw the foot up. Then the talar tilt test. So we'll do the inversion stretch test first. We'll have one hand stabilizing, other hand cups the calcaneus, keeping the foot in a neutral position, so not too much dorsiflexion, not too much plantar flexion. And then we're going to apply an inverse force. Then the eversion is the same thing, just push outwards. Alright, and then we have the external rotation or the Kleiger's test. So we're going to slightly dorsiflex the ankle, grasp around the first metatarsal, thumb around the forefoot, stabilize with the other hand, and then rotate laterally. Any pain there? Mm-hmm. Next is the distal tibiofibular joint play. So grasp here. We're going to try to move the fibula anteriorly and posteriorly. That's good. Cotton test. One hand stabilizes while the other cups the calcaneus. Then we're going to move the talus side to side. And finally, the Thompson test. I need you to lay on your stomach. I'm here. So your foot hangs off. So then, while the foot lays freely, we're going to squeeze the calf. Relax yourself too. And you see how the foot plantar flexes. So that means that the Achilles tendon has not ruptured. And that's it.